Conservers, or THC, the Gen Guru Institute, or JGI, will share the experiences and insights gained from over a decade of integrated programming across 5 regions of Tanzania, spanning 3 ecosystems. And these ecosystems are shown on the map in front of you. One ecosystem, or let's say, is the Greater Mahara ecosystem and the Gombe Masito Gala in the Kigoma and Katavi regions. This is located in the western part of Tanzania, known for its rich biodiversity and conservation challenges. We have the Northern Tanzania regions, or NTR, in Arusha and Manyara regions, where we have the Lake Manyara National Park, Tarangire National Park. This is an ecologically and economically unique and important landscape that supports both people and wildlife. The third ecosystem or landscape is the Ruaha-Rungwa ecosystem in the Iringa region, where we have the Ruaha National Park. This is a vital area for both wildlife and human populations, of course facing distinct conservation and development challenges. These ecosystems and the communities living around them face numerous conservation and development challenges caused by drought, floods, land degradation, unplanned grazing and deforestation. Through this session, our audience will gain invaluable insights into the successes of challenges and lessons learned from Pathfinder's PhD initiatives. Of course, contributing to the ongoing dialogue on effective strategies for integrating health, environmental sustainability, and community well-being into a single set of interventions. So, allow me to introduce our panelists. We are privileged to have 4 panelists. I will start with the one coming from the Gen Guru Institute, who is Dr. Samuel Kitaro. I'll bring them to the podium one and the other. Dr. Samuel Kitaro is the Deputy Chief of Party for the USAID Walkthrough Action Project at the Gen Guru Institute of JGI, bringing 14 years of experience in public health and biodiversity conservation. He's a Mandela Washington Fellow and he champions equitable health services for marginalized communities. Thank you, Dr. Samuel, for coming. Our second panelist is Dr. Kindo Alhiza. He comes from the Nature Conservers, where he serves as the program director for the Tungane program in the western Tanzania. Dr. Kindo is the, as I said, is the program director for the Tungane project at the Nature Conservers. He has over 20 years experience in holistic program leadership, including PhD programs. He holds a PhD in natural resource economics and several prestigious management certifications. Thank you, Dr. Kindo. My third panelist is Festo Kompa. Festo Kompa is a senior technical advisor for the PhD portfolio at Pathfinder International Tanzania. With over 11 years of experience in Tanzania's health sector, he specializes in public health, focusing on integrated health and biodiversity conservation, family planning, reproductive, maternal, newborn, child and adolescent health, and gender-based violence, all with a strong emphasis on community impact. Thank you, Professor. My last but not least, the only lady, is Eliza Kisau. Eliza Kisau is a community health worker and PhD champion from Gaboro village in the Kitoto district with 17 years of service. As a health educator and service provider at the community level, she has received extensive training in family planning, in maternal newborn child health through Pathfinder. Eliza has been a dedicated advocate for women's rights, health, and sustainable development in the community. And he also serves as a traditional leader. Before meeting Eliza, I used to think and know that like Wanani is a title for men. But when I met Eliza, I was surprised to learn that you can be a female like Wanani. And he told me he's among only two like Wanani in the district. Ladies and gentlemen, let's put our hands together for this fifth panel. Thank you so much, my guests. Let me start with Dr. Samuel. You come from the Gender Good Institute. What are the main goals and objectives of JHI's PhD initiatives in Tanzania? And why are these efforts crucial?
Thank you, moderator. Good afternoon. Good afternoon. It's the last session and we want to finish on high. If I was in church, I would say amen, and people would say amen. It's the last session and we have to finish on high. Thank you so much for that beautiful introduction. First of all, before we begin, let me just give you a little background about Jane Goodall. How many in the room knows the lady Jane? She turned 90 this year. Yeah, I see some hands. Most of you might have met her because she usually comes to Tanzania once a year or twice a year. And this year she was here when we celebrated her 90th birthday. And we are going to plant 90,000 trees to celebrate her 90th birthday this year. This is the lady whom we are going to share the story about all that we are going to talk about today. So she flew to Tanzania in 1960, a year just before independence. She was only 26 at that time. She was escorted by her mother and the famous archaeologist called Dr. Louis Leakey, whom we studied in school, who guided her. She wanted to do a research on the chimpanzee. So she was recommended by Dr. Louis Leakey to go to Gombe. This is where she went in 1960 to start research on chimpanzee. So at that time, that was 60 years ago, it was a very remote place. There were very few people in that area. It was not a national park yet at that time when she went to Gombe. Now she initiated that project, which is the longest in the world. Today we are talking about 60 years, the longest research, which continues until today, of these precious primates which are found in most places of Africa. So one day when she was going to Gombe, she flew over that land. She found that the land became very bare, no trees anymore, in which the chimps rely on the trees and other natural forests in that area for their survival. She learned one thing, and I would like to quote what she said: "We cannot save these precious creatures until we manage the needs of the people around that places." Deforestation was happening because people need charcoal. People need land for their agriculture. People have other livelihood needs. So Jane realized that until we solve or we help the communities around the Gombe National Park, this is where we can help to conserve the chimps and the environment. So that time she initiated an initiative called TACARE, Tanganyika Catchment Area Reforestation Ecosystem Program, which aimed to build its community-based conservation initiative, where you are addressing the needs, the livelihood needs of the people as you want to conserve. So she used like four steps. The first step, she said, we need to engage the community. You engage because we need buy-in from those communities. You need their participation in whatever you want to do. Yes, it's conservation, but without engaging the people around that area, which you need to conserve, you cannot achieve. So we needed to engage. And then she went on to introduce the second step. That is, you have to listen to the people. You know, most of us, from day one until today, I was listening to these experts. We think we have solutions to the people. You guys, you are here, you go, why don't you, this is a very fertile land. It doesn't work like that way. You know, they have their things. There are things which you need to learn from the community. You need to listen to them. So she introduced the Takare approach, which is the community-based conservation approach. You engage the people who are affected by that thing in order to achieve what you want to achieve. And the third step is to understand, help them to understand whatever the impact of things they are doing in their own lives. And lastly is action. So after people have been engaged, they have participated in whatever you want to do, you have educated them, you have learned together from your dialogues which you have together, then you can help each other to act, to provide appropriate actions which are needed for our conservation and the other things. So this is how Jen started the Takare approach, and our PhD programs built on the Takare approach, and other NGOs which are doing conservation, they build on that Takare approach from Jen Goodall. Then later on, in 1991, Jen initiated what's called Roots and Shoots. I will not be surprised if there are some Roots and Shoots members in the room. In the afternoon, I was walking the corridor talking to the RMO Manyara. He said, I was also one of the Roots and Shoots members. I would not be surprised if there are some Roots and Shoots members here. So in 1991, this is when Jen started Roots and Shoots. Because if you want to achieve behavior change, at times you need to begin at early stages. So whatever we want to achieve, we need to engage young people at their tender age. So we have the network of Roots and Shoots across the country, where we use this as a platform for us to promote positive behavior about animal welfare, about love for the nature, about care for the community. So we introduce these ideas at that tender age at the primary school. There are Roots and Shoots clubs at secondary school, and there are Roots and Shoots clubs in universities, because people continue with that compassion, being compassionate about our animals, being compassionate about community, and being compassionate about environment as well. So this is how Jen started the work, and we built, when you are talking about livelihood and the needs of the community, include their social needs, their healthy needs, and their economic needs and other things. We shall talk more about that, but it was a wide, wide spectrum activities which Jen initiated, and we are happy to be part of that activity.
Thank you so much, Dr. Ikaro, for elaborating where the JGI has come from and the perspectives Jen Goodall had. Of course, we get back to you to maybe to explain further how your work relates to people's health as well as well-being in general. Let me now move to Dr. Hiza. You come from the Nature Conservancy. What are the key goals and objectives of THC works in Tanzania? And why is this work important for conservation and community health?
Yeah, thank you so much, Felicia. Good afternoon. Yes, as Felicia has said, I'm coming from the Nature Conservancy, and we abbreviate it as THC. This is an international conservation organization. Here in Tanzania, we are having a decade plus of operations and implementation. But quickly, the goal of the Nature Conservancy in Tanzania is the same like in the whole globe. It is to ensure nature and people who depend on that nature are thriving together. They are coexisting. They are progressing together. So in that way, And like sometimes when you hear about conservation organization, you think these are weak people. They think about what and maybe forest only. But for the nature conservers, half of it, we want to see nature is well conserved and people who depend on that nature are also thriving. They are progressing. And starting quickly in sub-Saharan Africa, more than 80% of people who majority are in the rural area, they depend their livelihood on nature. And for that case, it is very crucial to ensure nature is well conserved to benefit the current generation as well as the future generation. Not only to see the beauty, but to ensure they are thriving, they are living, their livelihood and whatever. Particularly, we have a mission and a vision of seeing land and water, which all life depends on. Like when you read the SDGs, you see land and water is where actually the basis of life. We want to be well protected to benefit the current generation as well as the future. With the current global challenges of climate change, the Nature Conservancy is so much focusing on climate adaptation, and this including mitigation and resilience, but also we are focusing on water protection, and here we say fresh water, which include inland lakes and rivers, but also we want to see oceans protected, and here when we say protected, well accessed and benefiting livelihood of people, but also we want to see reduction of climate change impact as I said. The top and most important one, we want to see people benefiting well from their natural resource to address their livelihood challenge. And in that way, we are actually, because of that way, we are partnering. We as the nature conservers, mainly being somewhat scientific and much expert on natural resource conservation. So we are partnering with the health organization, Pathfinder International, to address this integrated, or we say interweaving, or like entanglement of people's need on nature as well as their health and livelihood.
Thank you so much, Tim. We'll get back to you. How THS conservation work affects the world, people's well-being, the climate change. I'll now come to she's the recruitment worker from THS. She's one of over 520 CHWs and PhD champions who are implementing our PhD interventions on the ground across the 5 districts. Eliza, naomba nikuulize swali. Wewe kama mhudumu wa afya ngazi ya jamii na pia kama PhD champion, majukumu yako ni yapi?
Habari ya jioni. Napenda sana kuwasalimu kwa jina la Yesu Kristo. Mimi siwezi kuongea kwa Kiingereza, ila nitaweza kuongea kwa Kiswahili. Na kabla sijajibu swali langu, napenda sana kuwashukuru sana walioandaa tamasha hili au kama maonyesho haya ya kukutanisha mashirika yote na nchi nyingi tu ambayo tumekuja kukutana hapa. Mimi ni mara yangu ya kwanza kufika hapa, hata baba hajafika, mama hajafika, lakini mimi nimejaliwa kufika. Namshukuru Mwenyezi Mungu kabisa. Pia sitanyima, maana sitakuwa mchoyo sana kwa ajili ya shirika la Pathfinder. Nashukuru sana, ni wao ndio wamekaa wakaona dada Eliza leo atoke nje ya nchi aone, aangaze macho. Kwa kweli shirika la Pathfinder walikuja walianzisha kufika Kiteto, lakini tumejaliwa sana kijiji chetu cha Ngabolo. Kwa hiyo katika swali lililoulizwa kwamba majukumu yangu ni yapi, baada ya shirika la Pathfinder kutupeleka kwenye mafunzo yafuatayo. Mafunzo ya awali kabisa ilikuwa ni ya vikoba, na mafunzo ya pili yalikuwa ni uzazi wa mpango pamoja na ukatili wa kijinsia. Na kweli tumekuja tukawa sasa tunagawa majukumu kama tulivyofundishwa. Kwanza, elimu tumepata ambayo ni jukumu la kwanza. Pili, tumekuja vijijini tukaanza kushirikisha na kuhamasisha watu kutoa elimu kupitia ngazi ya vikao ya vijiji, ngazi ya halmashauri kuu ya kijiji, kupitia mikutano mbalimbali kama vile mkutano wa Reproductive, kama mlivyoambiwa kwamba mimi ni mmojawapo wa kiongozi ya mila. Mimi nimechaguliwa, nina miaka 3 nikiwa kiongozi mama wa mila ambayo najulikana kiwilaya, na kutoa hamasa ndani ya jamii ni kupitia pia kanisani. Kwa hiyo jukumu langu la kwanza ni kwenda kutoa elimu ndani ya jamii iliyonichagua niende kupata mafunzo ya huduma ya jamii. Sijui kama nimekujibu vizuri.
Okay, asante sana. Kwa hiyo umesema kutoa elimu ngazi ya jamii. Jukumu lingine ulionayo na pia utaongezea Pathfinder au huu mradi wa watu afya mazingira ulikujengeaje uwezo kwa ajili ya kufanya kazi kwa nia kutekeleza mazingira kwa ufanisi?
Baada ya kutoa elimu ndani ya jamii iliyonituma, kwanza walipokea kwa uchache sana, lakini baadaye tulihamasisha mpaka wakaja kupokea. Baada ya kuona matendo yaliyokuwa tumefanikisha pale. Moja, zamani kabisa ilikuwa wakina mama wa Kimasai wanapeleshwa mimba kila wakati, apendavyo asipendavyo. Lakini baada ya kujifunza uzazi wa mpango na ukatili wa kijinsia na usafi wa mazingira, tulipokuwa tunahamasisha, wa kwanza kuitikia ni mama, kwa sababu ile mfumo dume wa wanaume bado ilikuwa inataka kuendelea. Wakasema huyu mama anakuja kutufanyia kututenganisha na wakina mama wetu, lakini baadaye tulielimisha kupitia zile vikao nilizosema, na wakaamini kwamba kweli shirika la Pathfinder wamefanya maana kabisa na kujengewa. Yani hiyo ya kwanza ya mpango ya uzazi imejenga kabisa ndani ya kina mama na wakina baba. Pia ndani ya ukatili wa kijinsia, zamani watoto wetu walikuwa wanaozwa wakiwa na miaka 10 mpaka 9, na mumewe kabisa anakaa na mwanamke, wanajadiliana kutafutia mtoto shuleni akiwa darasa la 3, akiwa darasa la 4 ili aje waozi. Lakini baadaye shirika hili walipotupatia nguvu ya elimu, tukaendea kaya hadi kaya, baba hadi mama, wakaja kujengeka na wakanufaika. Hawatoi sasa watoto wao shuleni, wanaelimika ndani ya mazingira yetu. Sisi wa Masai ni rafiki wa mazingira kabisa. Zamani huwezi kukata miti, huwezi kuchoma mkaa, huwezi kukata miti ovyo. Lakini baada ya kukusanyika au tuseme makabila wote kukusanyika ndani ya vijiji, tukaona mazingira yetu yanaenda vibaya. Lakini okovu zaidi na kuokoa shirika la Pathfinder kutoa elimu na yale mazingira yetu yakarudi kama yalivyokuwa zamani, na watu wameshajua maana ya mazingira. Napenda tu kusema kuongezea, kitu cha kwanza Wamasai walikuwa hawataki choo kabisa, wanaenda vichakani, na kwanza hawaendi na jembe, wanaenda hivi hivi, wala hawaendi na maji. Lakini baadaye shirika lilipo kuja kutoa elimu ya mazingira, tukaanza kujenga vyoo vya mfano, tukaanza kujenga kila kaya jiko la manifu, na wakakubali kabisa na wakapata mwitikio, maana wamepata mafanikio. Na mimi mmoja wapo ambaye nimepata mafanikio kupitia mafunzo niliyopata na Pathfinder. Walituanzisha elimu kwanza ya vikoba. Kwa hiyo tulipokuja kushika vikoba tukapata mafanikio zaidi. Mimi sasa hivi nasomesha watoto.
Asante sana. Kuja kwa baadaye kidogo.
Sasa
Tuambia kwa undani zaidi na mafanikio ambayo umeweza kuyapata kama kwa wewe kushiriki katika utekelezaji wa mradi huu. Okay, let me now turn to Festo. Festo, you are the field overseeing implementation of our PhD operations. What are the primary challenges faced when implementing these initiatives to promote health resilience in fire settings, particularly in integrating family planning and maintaining newborn and child health services with innovation efforts?
Okay, thank you very much. My name is Festo Komba, as mentioned. I'm a senior portfolio technical advisor for PhD projects. Before responding to your question, I'll start by providing an overview of PhD portfolio under Pathfinder. So under PhD portfolio, we have 4 projects. The first project we're implementing is TNC, is Tungane, and it is implemented in the western part of Tanzania, in 2 districts, in Uvinza, Kigoma, and in Tanganyika, in Katavi. And the second project is implemented in collaboration with TNC also, but it's mainly in the northern part of Tanzania, in Arusha and Manyara, but also we are working close with another stakeholder or partner in Iringa, and Iringa district, Ansel and Mufindi. Also we have another private donors, MAPB, which is mainly supporting the livelihood activities in our landscape, and also we have Swift projects. So under PhD portfolio, we are doing all those activities to make sure we integrate environmental conservation and sexual and reproductive health. As you know, human being is an integrated being. A human being is not depending on one kind of intervention. You cannot depend on only vertical programs like family planning program alone, or RMCH program alone, or conservation alone. The aim of this theme here is to show you how we need to change our mindset to integration side. As you know, the increase of population have an impact on health, but also increase in population have also an impact or effect on environmental conservation. So we need to change our mindset and make sure we emphasize integrated projects in order to tackle different challenges when we are implementing one program. So coming to your question, with regard to what are the challenges we are facing when implementing PhD programs. So because this is a new concept, so we have encountered different challenges while implementing this project. And as you know, we are talking about the fragile setting. These are remote setting which face different challenges, such as socio-economic challenges and environmental challenges. But also in the western part of Tanzania, we are also having some issues with security in the neighborhood countries. So in this fragile setting, when you are implementing your program in these settings, there are a lot of challenges. One is with regard to access to service. Health facilities are far apart, but also the geographical location. Infrastructure also is a challenge. So you have to consider all those aspects and make sure you structure your project in such a way you can overcome those challenges of accessibility to service. But also we face challenge on illiteracy rate. With a remote setting, the illiteracy rate is high. So we are facing this challenge and making sure we provide education, sensitization to community members to understand our programs and accept the interventions that we are conducting in those areas. We are also facing the issue of poverty. Poverty also is a problem. Sometimes you have clients who need family planning service, have been referred for permanent use of family planning service, but they can't travel to the facility to access those services. So it is very important to make sure we consider this aspect and support those clients to access services. We are also facing challenge on expertise, on PhD. So as Pathfinder, we are working with some experts and some institutes. We have worked with University of Dar es Salaam to develop curriculum. And this curriculum is aiming to enroll students in master's program or PhD, and making sure we have experts who help this country in PhD activities. But also, as I said, we need to change our mindset on the integration part. Our healthcare providers need to be trained on making sure when they deliver a message with regard to family planning service or RMCH service, they also provide education with regard to environmental conservation, because these issues go parallel. So those are the issues that we also need to make sure we do to ensure our expertise use platforms using during the routine service provision to also provide education with regard to conservation. We also have, as a country, challenge of police. There is police here on the integration, the family planning and conservation integration. So this will also create a gap when implementing our project. Also, I can say maybe the last challenge which I can mention is with regard to funding. Currently, we are funded by USA and some private donors, so we are thankful on that regard. But the sustainability also depends on multiple donors supporting these PhD interventions. So we are calling upon more donors to support PhD integration so that this concept can be scaled. Thank you.
Thank you so much, Festo, for sharing the various challenges that you are facing in the free during implementation of PhD initiatives. I'll now go back to Dr. Samuel. You explained the vision Dr. Jane Goodhardy, as well as the initiatives that followed the chimpanzees population protection. Now my question is, how do the PhD strategies implemented by the Jane Goodhardy Institute align with the SRH and address the climate change challenges? And can you provide also examples where integration of PhD strategies has led to health and economic resilience in the local settings where you are operating?
Yeah, thank you. First of all, let me mention that climate change is real. Climate change has affected us as people and communities. We are all affected by the impacts of climate change. We have health facilities which, for example, this year, many places in Tanzania reported floods and then extreme heat 2 years ago. So there are health facilities which submerged because of the flooding and other impacts. So we aligned climate change impacts as well as the integrated PHE approaches, and they use all those platforms. Much as we help to conserve diversity, we want to also use those platforms, which are first mentioned platforms like natural resource management platform, as a place where we can also talk about SRH. These are the places where we can also reach beyond, not only the natural resource management teams, but we can also speak about SRH, sexual reproductive health. We can speak about family planning in those natural resource management platforms. So much as we are speaking about the climate change impacts, we also speak about improved access at family planning. Today in the morning I was attending one session, care in the Pathfinder session. There was a lady who was so passionate. She said, wanaume tunawapenda lakini si ndio? She said we love men, but there are some things. So one of the area where we are really getting men to be engaged in family planning SRH services is through the natural resource management platforms. These are platforms which are predominantly for men. Men are the ones who are doing forest patrols. Men are the ones who are dominating village natural resource committees. I don't know if these people knows that at the village level there is a village government. In the village government there are some small committees, including very powerful committee called Village Natural Resource Management. These are very strong committees which are mainly dominated by men. So when we are doing population health and environment activities targeting these VNRCs, these are the places where we can also get men to be engaged. So in natural resource management, I'm not an expert in that area, Lukilo is an expert in that area, but we speak about SRH services in those platforms. We talk about equity, we talk about inclusion of men and women in those village leadership, in village natural resource management. So this is the place where we are also sensitizing men about joint decision making. So much as we are doing joint decision making in natural resource management, we are encouraging them to make joint decision making regarding their family planning needs, regarding their SRH needs at that. So we very much use those platforms as an entry point to engage men. In a way, it has helped us to increase access to family planning and other SRH services because we are reaching more men than usual platforms. Men are not coming to the health facilities, so we are going to where you have to go where men are. So men are in these areas. So we are talking about natural resource management. At that time, we talk also about their health needs. So climate change. I was attending the conference on international conference on population. There was a huge discussion regarding population health and the environment. And they said, you know what, should Africa, there was a question there, should Africa pursue a replacement level fertility? We didn't conclude that discussion. It was a huge discussion, there are various perspectives about replacement level fertility. 2.1 is considered as a replacement level fertility. Should we go that way or should we choose another way? There are advantages of high population. There are also disadvantage of rapid population in some areas. So we are not here to say we go which way, but each approach has its own advantages and the disadvantages. But we have to learn that the resources are not growing. The population is increasing, but our natural resources which we depend for our livelihood are not increasing. And when the air is degraded, the soil is degraded, it impacts our life. And there are so many waterborne diseases which are coming these days because of degraded environment. So we consider all those. And then another thing, let me talk about also the gender-based violence, which can also increase as a result of the climate shocks. We have seen many families which have opted to, especially girls are highly affected because in places where there's a big family, boys and girls in those families, and there could be challenges with food security. These families tend to opt to encourage early marriage, especially for a girl child, to reduce the number of mouths to feed in that family. So climate change may affect well-being of the family, but also exposes the girl child in those families to female genital mutilation or gender-based violence of every kind, including early marriage. So much as we are addressing biodiversity, in a way, we are addressing gender-based violence, we are speaking about the inclusion of men and women in decision-making regarding natural resources. We are also encouraging them about decision regarding their family size and other things. In fact, the well-spaced families are more resilient. You spoke about resilience. They are more capable of feeding their families or providing for their families as compared to the families where spacing between child is very small. So we can have further debate on that, but that's the reality. So talking about improving resilience of our communities is also talking about spacing of children. And that's fine. Thank you.
Thank you so much, Dr. Samuel. Dr. Kindo, you have explained what THC is doing. Can you explain how the organization collaborates with the health partners like Pathfinder to ensure an integrated approach to conservation and SRH in fragile settings? And also, if you can share examples to illustrate if the integrated approach is working, the geographies where you're operating.
Yeah, thank you so much. As you said, in fragile setting, I'd like to start with mathematical analog. And bear with me, please. Some people, they don't want to hear about mathematics, but I want to remind you a little bit. When we start with the mathematics, and things are not very difficult, we start with the arithmetics. And this is, we say 1 plus 1 is equal to 2, 3 minus 1 is equal to 2, or 1 plus b is equal to 3. Those are arithmetics. And when we go a little bit higher classes, we meet complicated things a little bit. And there we get algebra. So we get y square is equal to a x square plus b x plus c. And there is where you start solving quadratic equation or equation which you can take them 2 in 1. But when things goes to higher level where they are very complex, there you get calculus, and then you get dy dx is equal to. And if you want to solve it, you use it integration. For those who love the mathematics, you need that symbol which is like S. So integration is the approach we use when we meet complicated and difficult things. Not only in mathematics language, but even in conservation and health language. And what do I mean here? Putting this complicated calculus into very simple explanation. When we meet people and their nature in fragile context, the interdependence of each other is becoming more complicated than what we can explain in a few minutes. There you find putting food on table is a challenge for the family. There you find health issues are very serious challenges. There you find, like what he said, access to health services are very complicated and sometimes none. But illiteracy, poverty, all these which are mentioned are challenges which have to be addressed. So, in order to solve them, you cannot use an arithmetic approach, you cannot use algebra, but you need calculus, and that is integration. What do I mean here in simple language? For example, in the Western, you said, can I say it in the simple language? In the Western Tanzania, along the Tanganyika shore, there were these fragility complexes mentioned. A family which was given a mosquito net to use it for preventing malaria, we as conservation organization, we found out that they were using the same mosquito net to do fishing. So they were using mosquito net to have baby fish, and that they are fishing. So it's having a negative impact to conservation because they are decreasing a fish population on which, I said it earlier, they depend on this natural resource for their livelihood, but they are decreasing production in this one. But in the other side, the intended goal of decreasing malaria prevalence to them is not also attained. So there are unique couples. You need a health partner who is explaining about health, but another partner who is explaining about natural resource protection. And that's what we did with Pathfinder International. The nature conservers can explain about not decreasing fish population by unsustainable access, but we needed Pathfinder to speak about their health. But she said about Maasai and open defecation. But then also we found the cost of people, they were using lead in their toilet, so they didn't have toilet. So they're increasing open defecation and challenges in the fisheries and the water quality, and they're using the same water for drinking, and they become sick. And when they become sick, they cannot go fishing in deep water. They need to fish in near water, so they are decreasing fish population. They should keep it like that. How can you explain it? We as conservation organization can explain only, don't fish here near shore, but we need a health organization who can explain about primary health and about their water and sanitation, as well as the point which Kikaro has just spoken. When we met there, we find spacing of children is like, and a woman who has just given birth last year, and this year you say, don't fish here near shore, go fish there, babe. How is she going to do it? She will do it here because she doesn't have good energy of going far. But she needs to keep their fish population high. But she needs also to put food on the table. So there we need again a health partner who can explain about spacing, better spacing of children, maybe through the reproductive health. And the other side we speak about the natural resource conservation. I just spoken one example of fisheries resource. But the same set goes to livelihood. They don't have it in Africa, so they need a climate adaptation, they need good cooking stoves. We need somebody who can teach them livelihood issue, but also teaching them the other side of natural resource protection. Because they are interwoven. The natural resource and health are so much connected, or environmental and health are so much connected. And because of that, we said, how can I say it about? We have been seeing this community quickly increasing their knowledge on the importance of their natural resource for sustainable access, and the importance of their health. What can we say? Two things quickly, which we learned. And not only Tanzania, but most of the sub-Saharan Africa. We are doing a lot of studies because TNC is a science-based organization. Two main things people they will prioritize. One, their health. That's the first. So they will tell you, kill me or my health, because that is first priority. But the second one, food security. If they don't have food on their table, they'll do whatever. Don't say don't fish here near shore, and they don't have food. They don't put a plate food for their family. For that case, we needed a livelihood addressing, and we did it through Pathfinder International, like Kokoba, like which is increasing income, like the one which I have spoken, doing a better farming, at least a pot, and nutrition. But also they needed to have a good health, which I have already spoken, mainly primary health, and also to know the relationship with their natural resource, which of which they depend on. For us, we have seen them gaining a greater number quickly of people adopting this, proving that it is working. We proved it also by evaluation, and the data of the recent 10 years evaluation showed that not only health and the reproductive health or sexual reproductive health gaining bigger number, but also natural resource conservation. And people, they are saying they think they will be having this natural resource to address their life for many years, more than whatever it was going back. So for me, I'll say PHE, the best approach, integrated approach, and should be used in different places, because the life is not in a arithmetic. The real life is in interdependence, and that is helpless, and we need integration. Thank you so much.
Thank you so much, Dr. Mukindo, for sharing the strategies TNC is using to address the various needs or problems of our people on the ground. First of all, very quickly, we are almost running out of time. Can you share specific examples of the effective strategies from Pathfinder that have successfully integrated PHE in these settings?
Okay, thank you very much. I just wanted to refer to what Sam said. Climate change is real, and with climate change, we are also talking about shocks that people in fragile setting are facing, specifically on issues with regard to flood, drought, and issues with regard to conservation, deforestation, bushfire, etc. So the projects that we are implementing is mainly helping our communities to create health resilience, economic resilience, and environmental resilience. So different models that we are implementing aiming to achieve those things that I have mentioned: health resilience, economic resilience, and environmental resilience. So we have different models that we are implementing, one of which being the PHE school clubs. We have these clubs in school with at least 30 members in each school. We are teaching them with regard to SRH and environmental conservation, but also we are creating awareness with regard to GBV, also with regard to livelihood activities. So these kids, aged 8 to 18, when having knowledge, they can transfer this knowledge to their families, to their communities, and making sure we create change as a community, and our communities are becoming resilient with regard to environmental and economic, but also on health aspect. Also, we are also supporting community conservation microfinance groups. So we have many groups we have created, and we are supporting them in almost all 5 regions that we are supporting. And by giving you some numbers, we have at least 209 groups with about 5,197 members, and 73% of these members are women. So this is a women-led climate resilience project. So we are happy because most women are members of the CCMGs, and they are able to boost the economy and making sure they cut the cost of life. These CCMGs have a total share of about 2 billion Tanzanian shillings, and from these shares, the members can borrow those money, and this money can assist them in their health problem, accessing health insurance, they improve the community health fund, and accessing healthcare service in health facilities. About 9% of our members have access to ICHF, and in numbers it's about 471. members have improved the community health funds. We are also, said by Kilo, we are also using CCMG as a platform to create awareness on SRH and family planning and GPV issues. So these members are aware on SRH and GPV. They are also accessing family planning, but also we have created economic resilience to these members. Apart from COCOBA or Community Conservation and Finance Groups, we also have model households. Okay, I will be completed. We also have model households. Model households in simple terms we say, kwa Kiswahili we can say ni kaya ya mfano. In these model households, we have identified families whose members are practicing positive health behavior, but also environmental conservation behaviors. In these families, you can see women attending health facilities for accessing health services, but also men. Some men have access to family planning services like vasectomy, but also the family is practicing wash activities, but also they conserve the environment, planting trees, etc., etc. We have some criteria, like 22 criteria, which guide us on selecting these model households.
Thank you so much. First, Eliza, naomba nikuulize swali la mwisho. Wewe ni mhudumu wa afya ngazi ya jamii, lakini pia mkufunzi wa COCOBA na mwanachama pia au mkufunzi wa COCOBA. Ni kwa namna gani ambavyo umeweza kunufaika na shughuli zetu za miradi ya watu wa mazingira? Na pili, mabadiliko gani chanya umeyaona kwenye jamii yako yanayochangiwa na uwepo wa miradi yetu hii? Hata mafanikio kwa upande wako.
Asante sana. Kwa upande wangu mimi nimefanikiwa sana. Kwanza nimefanikiwa kielimu, pili nimefanikiwa kiuchumi pia. Mfano, nikitoa mfano hai, mimi nimesomesha watoto wangu, nina watoto 4 na 2 wamemaliza sekondari na mmoja amehitimu la 7 juzi. Na naamini kupitia COCOBA ataendelea tu na masomo. Na pia kila mwaka tukivunja COCOBA, naamini kabisa nitanunua mifugo mbuzi na ng'ombe, na hata sasa hivi ninapokaa hapa nimejenga room 3 kupitia COCOBA ya mfano ya pamoja. Kwa hiyo naamini kabisa nimefanikiwa kupitia shirika la Pathfinder katika mafunzo yaliyokupatia. Sijacheza nayo. Na katika leja nilizoona ndani ya jamii yetu, kwanza wameelimika vizuri, wameelimika na wameitikia mafunzo tuliyoleta na kuelimisha wao, na wamepokea, kwa sababu katika COCOBA Wamasai walikuwa hawapendi sana COCOBA, lakini sasa hivi wanajitokeza na wanaunda wenyewe bila kupewa mafunzo kupitia COCOBA yetu sisi. Na pia katika nyanja hiyo ya jamii, wengi sana wamejenga kupitia elimu waliopata. Na katika tuseme mpango wa uzazi, ukikaa na mume na mke anakusikiliza vizuri, unampa dawa, unamshauri aende hospitalini na anakubali. Kwa hiyo mimi naona kwamba wamefunguka.
Asante sana Liza. Thank you so much my panelists. We are left with about 20 minutes, and I think we should open the floor for questions before we close our discussion. Karibuni kwa ajili ya maswali na comments. I see one hand there. You mentioned your name and the organization you represent before asking a question or making a comment.
Hello, my name is Julia Bezana. I'm coming from D3, but I'm very proud that I used to work for both Pathfinder and the Nature Conservancy, and we were part of the team that designed the Tuungani project in 2010. So I'm so proud to be part of this dialogue, and so proud to have seen how far we've come with this dialogue. And having such a powerful panel, it's so amazing. And you've mentioned all the right things, and I'm glad we've heard them. I just have one comment and one question. My comment is regarding the discussion on family planning. And I think we often tend to live behind the topic of reproductive rights. And I think when we mention family planning, the two have to come hand in hand and always mentioned together. So that was just one comment. A question I have is around, typically population health and environment projects happen in very remote communities. As implementers working in other fields right now, what can we do to have PHE mainstream in other areas? For example, how can we have it mainstreamed here in Zanzibar? Thank you. Mongareni-san.
Yes, thank you. My name is Gary Josephat. I'm working with the Africa Tanzania. We say the Vision Project in Kigoma. First of all, I want to congratulate the panelists for the nice discussion. So I would agree with you. It is true that the population is increasing and the natural resource is constant. And this is a fact, you can't deny it. It is true. I remember last week I was going to Galia, crossing around the forest. You can find between the forest there are people who are cultivating there. So this is because the place where they were living before, the population is high, so they want to find somewhere where they can survive. So my question is, do you think we are doing enough to make sure that the population increase is growing proportion to the effort we are putting to ensure that the natural resource and environment is safe as population grow? Because the population will grow whether we like it or we don't like it. And if we sustain this effort, do you think we will rescue the environment we have with the effort we are putting right now? Thank you.
Thank you. Maybe before I invite more hands, let's try to respond to these two questions. Maybe we start with the first question. What will be done to have PHE interventions mainstreamed in other areas? Because we have seen currently we are implementing our PHE interventions in rural and high-rich areas. Dr. Samba, can you start? Thank you.
Thank you for both questions and thank you for the compliments. We are implementing a right-based family planning, reproductive health services. We consider all human rights as we implement these approaches. Connecting it to the questions which Dr. Eli mentioned, the family planning, reproductive health are voluntary. They are voluntary services. What can we do to ensure that population does not increase? We we can do nothing. What we can do now, we can continue educating them about importance of spacing, importance of considering family size as the country is increasing. I would like to bring the DD discussion here, demographic dividend. I know there are some experts here. They may talk more about that in connection to your question. But the fact is, population is increasing, and you cannot force people not to continue to reproduce. It's voluntary. For us, it's to preach, and a few people will accept. Many people will accept, and we are seeing the trend now, uptake of family planning, reproductive health and rights is increasing. Not universal. There are places where uptake is very high, and then there are other places where uptake is very low, including these fragile areas which are living close to the national parks and the other conserved areas. So one little thing which I don't want to leave the stage without mentioning is the benefits of conserving the environment. I want to share with you, there are some villages which we're talking about universal health access. There are villages which receive incentives for protecting the environment, and they use that money, the carbon money, to get health insurance to all villagers. Can you imagine? The whole village is covered. They receive their health insurance because of the forest sitting near to that village. So that's a big advantage and an incentive for those villagers who are protecting those conserved natural resources for their own benefit. But as much as these programs are speaking about villagers to adopt climate smart agricultural practices, they get money. They also improve food security for their own society. So there are so many advantages of engaging in these climate smart practices to this community. Thanks.
Thank you so much, Dr. Samuel. And to conclude very briefly, is it possible to emulate our PhD interventions in other localities, maybe including urban areas? What are your views on that?
Yeah, thank you. But I wanted to start with a curious question. What should we do maybe to mainstream PhD in Zanzibar? So, in this PhD program, we have started a policy review and proposing to have East Africa PhD, not only Zanzibar, but we wanted to have Tanzania PhD policy. And when we reach that time of having policy, obviously it is going to be an extremely different area, and we are not only targeting Tanzania, we are targeting the whole East Africa. But also to remind what you were saying, not only to mainstream it, we want to have experts on PhD, and that's why there is an initiative to have at least PhD curriculum for masters in University of Arizona. But if it can be widened so that our universities can produce experts, not only to our people from engineering. So it is a work in progress. But again, going to is are we doing enough? If you have to say, we are among of the growing regions, but also Tanzania is growing in terms of what are we doing. Most of this land we see and our water, when we see it, they didn't have water management plan, or we say marine spatial plan. We didn't have enough land use plan in Tanzania. Very few villages are having it. So you see the encroachment. In one side, we are speaking about our population growth, but how are we managing our resource? So what we are doing now is to ensure we are having resource, we call 3R. Don't misquote me with 4R of Mama Samia, but for us we have 3R. Resource tenure. How are they managing their resource right? But also resource management. How are they governing it? And resource financing. What are they benefiting, like carbon financing and the others? So call it kind of resource, whatever. But all of this, all I wanted to say, it is a work in progress. We started with the high priority area, and this the one we call fragile area. And maybe fortunate, our organizations, Pathfinder and TNC, they always target hard to reach area and mostly fragile area. So we are doing, but we haven't reached the maximum of ensuring they can balance their resource management.
Thank you so much, my panelists. We have like 9 minutes. Maybe you take one final question. Final question I saw somewhere. Yes, someone wants to ask a question. Maybe we take that final question and then we close our discussion.
Yeah, thank you very much, Felicia. My name is Wema from Plan International. So my question would be, in the name of sustainability, I know we've had a concept for a long time of population health and environment. We have a lot of strategies, action plans, commitments, guidelines, policy expiring between 2020, 2025, 2030. Reproductive health documents. Is there any plan of influencing some of these lessons learned in the approach of integration of population and the environment within the reproductive health documents?
Thank you. My name is Gaila from the USA Atlantic Project. Thank you for your nice discussion. Among the things we know about the sexual reproductive health, which are going to reduce the fertility rate, is including sustaining especially female girls in school. So I wanted to know, because currently we are experiencing, we are enrolling a lot of school actually in primary and secondary, but some of them are not completing their education. So I wanted to know maybe what are we doing in terms of our programs in those school students who drop out. Because when they drop out at earlier age, we find ourselves that they're exposed to maybe sexual behavior earlier than expected when compared to if they were kept in school. So I wanted to know what we are doing in that area and possibly what policies could we influence in order to improve that.
Thank you so much. I will direct that question to Kido because I know James is doing some work on that. Briefly, Dr. Kido.
Thank you so much because you said it briefly. Maybe I start with even sustainability. When we say sustainability, the main pillar in sustainability is financial sustainability. We can have the team of community team trained also, but how are they managing it? Is when they are having financial capacity. This is what Kikaro said. When we are having this integrated plan, they get finance from their forest, and I tell you, even if we leave that area today, they'll be continuing to manage their forest and to have health insurance because they have seen the benefit. So most times, sustainability were failing in different areas in financial sustainability. But now we are addressing it under integrated program of teaching. But again, what do we do with the dropout? We are treating both the problem and the causative issue. The causative issue of dropout, if you treat dropout after a student has dropped, then you are treating the problem, or maybe that the symptom of the challenge you have. So what do we do with the increasing dropout? We are supporting girls' education. We do training in this PhD class, but also we are doing training youth friendly in Pathfinder's outreach and meeting, but also we are supporting girls' education by supporting dormitories and scholarship, because most times they are dropping out because of those challenges. But even when they drop out, for example, because of maybe first pregnant, we have one program which we call First Time Parents. It is somehow a program, but somehow an embedment of PhD. So this First Time Parents, they also richly and be capacitated.
Thank you so much for responding to the questions. Our audience wish we have more time for questions and comments, but before we close our panel, I would would like to give maybe a few seconds to each of our panelists for final remarks. Eliza, natoa nafasi, tutatoa kwa muda mfupi kama tunaweka hivyo ongea machache kwa wasikilizaji wetu. Kwanza na Eliza.
Asante. Nina machache mawili tu. Kwanza nashukuru kabisa. Ya pili, machache ninayoongezea kuhusiana na ukatili wa kijinsia. Ukatili wa kijinsia ni jambo kabisa ambayo imeenea, sio sisi Wamasai tu, ni sisi wote. Pale kwetu sisi tuko mchanganyiko, lakini jamii ya Masai wameacha sana kuwapiga watoto, lakini jamii ya Waswahili watoto wanatukimbilia kuja kuomba msamaha kwa ajili ya ukatili wa kijinsia. Mtoto akienda kucheza ananyima haki ya kucheza, na mtoto ana haki ya kucheza, ana haki ya kusikilizwa, yaani mtoto ana haki zake zote. Lakini mimi nawasihi tu, kama tulivyofundishwa na shirika la Pathfinder, mimi nasema tupeleke hii elimu majumbani, tupeleke vijijini kabisa kwa ajili ya kandamizi ya mtoto. Sisi wazazi, sio mwanaume sio mwanamke, tunawakandamiza watoto wetu. Mimi nasema tunaya yote kwa sababu tumeelimika, ndio maana tumeelimika, tusifiche elimu yetu. Na hata kama wewe umeelimika zaidi, kuna mdogo sana ambayo hajawahi kupata hii elimu. Kwa hiyo mimi nawashukuru sana sana, sijui niseme nini, sijui niseme nirudie tena kuja huku, sijui mtanipenda, lakini mimi nawapenda sana.
One of the best contraception is to keep a girl child in school. So much as we are doing all these things, let's help a girl child to remain in school. That will help us, will help communities to advance. But somebody mentioned about sustainability of PHE, mainstreaming of PHE to other places. Currently, PHE is sitting at the Vice President's office. We want very much to be also in the health sector, not implementing these in silos. So we have East Africa Reproductive Health Network. One of their themes is to promote PHE integration in all programs. So may I take this opportunity to call upon the government to embrace the PHE initiatives, not only in health sector, but also to activate the PHE section under the Vice President's office, because once we do, we are targeting the same mwananchi, down there, who is not only affected by health issues, he or she is affected by poverty, is affected by lack of education, and all other things. So our approach should always be integrated. And how I wish PHE to be across the country, across all ministries. Thank you.
Thank you so much. Thank you. Very briefly.
Thank you so much. To me, actually, is to call upon this innovative kind of integration. And here, actually, I'm giving a lot of regards to Pathfinder International, because it is common to see a health-focused organization partner with another health-focused organization. It is common to see conservation or natural resource protection organization to partner with another natural resource conservation organization. But it is uncommon, it's a rare issue to see a health organization partnering with the conservation organization, and we saw Pathfinder is leading it. And actually that is the basis of PHE, or solving things in integrated manner and not in silos. So I'm calling upon different people to be ambassadors of this integrated program. Had we had maybe donor community, I would say the same. Donor community also should start thinking in terms of integrated programming, not in silos. Thank you so much.
Thank you. Last question.
Thank you very much. Climate change is real. We are facing a lot of shocks. As a healthcare expert, are we prepared to respond to these shocks? Do we have emergency preparedness and response plans in our facilities? That is a question for the healthcare provider and the health sector. But also, the economists, are we ready to bounce back up after being faced by shocks? There is environmental experts. Are we ready to create environmental resilience? So those are some issues which I need you to think about and make sure we have these emergency preparedness in place, but also we have some economic strategies and some environmental strategies to ensure communities are resilient enough when faced with shocks.
Thank you so much, my panelists, for making this forum a learning opportunity. But also I want to extend my thanks to all of our audience on behalf of Pathfinder and the partners THS and JGI. Really appreciate you coming here. So this was really wonderful, and I appreciate the opportunity to moderate this discussion. So this marks the end of our panel. And before we leave this room, we would love to have a group photo with our PhD partners. I know we're not a very big group, not to fit in the photo. So before you leave this room, we really appreciate it. Thank you so much once again.